During a recent parliamentary debate on expanding abortion access in New South Wales, ABC News Verify found 11 MPs from across the political spectrum citing a flawed US paper on the safety of an abortion drug.
I draw the House's attention to a recent significant study by the Ethics and Public Policy Centre entitled "The Abortion Pill Harms Women."
The study found a serious adverse event rate of over 10% in medical abortion.
And the study claims to show a more than 10% risk of serious adverse events.
The study revealed, as many people in this House have already commented upon, that over 10% of women suffered an adverse event.
The study they were referring to was this one, published by a US-based conservative think tank on April 28th. The report says the rate of adverse events after mifepristone abortion was approximately 22 times more frequent than the US Food and Drug Administration currently recognizes. This sounds alarming, as mifepristone is one of the drugs that are used in early-stage medical abortions in Australia. But experts told ABC News Verify that the paper's methodology was flawed. How it classifies repeated surgical abortions as severe adverse event is just one of the things they found wrong with the paper, which wasn't peer-reviewed. The EPPC says its data was drawn from a commercially available health insurance claims database. But a spokesman refused to tell us the name of that database, so there are transparency issues as well. But how did that paper end up in New South Wales Parliament? It's not clear how so many MPs came to quote the paper, but the debates occurred amidst a push by Conservatives in the US for tighter restrictions on the drug. On April 24th, US Food and Drug Administration Commissioner Martin McCarry told PBS News if the data on mifepristone
suggests something or tells us that there's a real signal, then we can't promise we're not going to act on that data that we have not yet seen.
Days later, the report was seized upon by Republican Senator Josh Hawley, who has a long history of anti-abortion positions. In response to a question from Senator Hawley at a congressional hearing, Health and Human Services Secretary Robert F. Kennedy Jr. said that he had ordered a complete review of the drug. In New South Wales, the Parliament has voted to allow nurse practitioners and endorsed midwives to prescribe the drug, so it will soon be easier for people to access the mifepristone in the state.